Thank you for giving us a chance to talk to you. I certainly want to also thank everyone in this room for the work you do on behalf of your customers, but also on behalf of our customers. Your commitment to training and individual development has really allowed you to help us as plans get through not only phase one of healthcare reform, but also the advent of high deductible products, cost-sharing products, and the integration of financial vehicles, and now, of course, national healthcare reform. And so the work you do on behalf of our customers is invaluable to the plans, and so I wanted to thank you for that, and thank you for your continued commitment. And of course, when I look at that, you're an extension of that because you distribute our products, you represent us to the customer. So I think about what it means to you as a business, and then I also tend to look at it from the end result, the financial aspect, because I think as Mark appropriately stated in his note in the booklet for this meeting, is that it really is about cost. And each of my fellow presenters have talked about the fact that cost has to be addressed if at the root of any of the solutions that we're going to have. So let me comment first on the state, where I think we are at the state, and I'll keep this very simple. And what I think is that, and I just had this conversation with Lisa, that we do need to work with the connector, hold them accountable for, first and foremost, understanding what the phase one has meant to us as a Commonwealth and as insurers, as employers, as brokers, and to work with the state to understand the changes that need to be made to make the program more sustainable. Because I think Jim's absolutely right. The overall cost of health care has not changed. The utilization and cost of care hasn't changed because of health care reform. But some of the restrictions, some of the pricing restrictions in the merged market have created an impact on the sustainability of this program for plans. So I think we need to learn from the first phase and work together with the state to move forward. And I have had that conversation with John Kingsdale to make sure there was no miscommunication on my part on that. So anyway, I think that's the biggest takeaway. I know there's things to learn. And I think where we've been supportive in this state is around, and I think most of the plans are around, making sure that the connector can be a good vehicle for access to insurance, to a gateway to insurance for individuals. I'm not so convinced that what the connector wants to do in the group market is helping to make the initiative sustainable, and in fact I think it might be debilitating. So I also think we need to be clear on what works and what doesn't work at the state relative to the next phase of what we're doing relative to reform here. Let me talk on the national level as well. I think where we are, it seems that a lot of the debate is being framed up mostly around access to care and coverage. And then, of course, secondarily is cost. I think most of the work has been around access, and we've been lobbying through not only our national association, through AHIP, Association of Health Insurance Plans, and then, of course, on our own behalf, we've been down in D.C., trying to influence the discussion and the debate around some of the more complex things, and I would say that is around the affordability, the cost side of the equation, and I'll come back to that in a second. But I want to be clear that what our message is, both through the organizations that we're represented down in D.C. with, but also our own local plan, certainly supports the insurance reforms that are being discussed. As Jim indicated, and Bruce, we're already there in Massachusetts, so we've understood the importance of those insurance schemes that did not allow sick individuals to obtain coverage. We've already moved well past that in our earlier health care reform. I guess it was 0.5 now. So I think we're there. We support the insurance and the reforms. We don't support a public plan. We don't view the public plan in any form that is being discussed as being one that is creates a level playing field. So we've been clear on that. we do support the concept of exchanges, just as I alluded to how we supported Massachusetts, that they can be a good vehicle for access to insurance and information about plans and affordable plans for individuals. We support them in that limited scope and do not support them in a broader scope. And if the scope is going to be broader and the exchanges, there needs to be clarity on the underwriting rules and the marketing and distribution rules so that there is a level playing field in those exchanges or co-ops. And lastly, and most importantly, we do support payment reform as a key component of, a key tenet of healthcare reform. It really is about cost at the end of the day, and that's the only way really to get at cost is to look at the way services are consumed and therefore paid for. You know, I'll share one conversation that our CEO, Cleve Killingsworth, had with Senator Baucus when he went down with a group from the New England business community to talk to Senator Baucus. And at the end of that meeting, he encouraged Senator Baucus to think about having Medicare move totally to a global payment system, because the challenge of each of our individual plans trying to move the system towards global payment, as Eric indicated, you got multiple plans negotiating with multiple accountable health organizations, and it would be a Herculean task to move that in any type of time frame that will solve the affordability challenges that the country faces. So so that's some encouragement that we've been giving the senator. The answer was that will never happen. So.